This is Stigma, where we talk with leaders from many industries about how mental health and addiction have impacted their lives. Many people suffer silently from mental illness, addiction, depression, anxiety, and trauma. They never seek help because of stigma. In this podcast, host Stephen Hayes and his guests share their stories of recovery in order to encourage others to do the same. Here's Stephen.
Welcome back to another episode of the Stigma podcast. Today's guest is Ryan Hampton. Ryan has a powerful story of recovery from addiction. He is a writer. He's the author of a book called American Fix. He is an activist around addiction and recovery, politically, nationwide. He's living in recovery himself. He's been a friend. He's been an advisor. He's been good to me as I've made my way in recovery and tried to build the podcast and tried to build the venture fund around this space. And I would tell you that nobody else knows as much as he does about the politics, about the healthcare system, about the legislation, and about how all of those pieces work together in and around recovery and what has been done and what needs to be done. And we're going to dig into that a little bit here. There's a number of ways to get in touch with him. He's on social media. He has a website. I will link all of that in the show notes for you. But without further ado, let's get into it. Ryan, thanks for coming on, man.
Thanks for having me on. I'm excited to be here.
Yeah, I've been really looking forward to this conversation. And where I kind of wanted to start was really with, if you wouldn't mind sharing your sort of recovery story. I think that would be helpful for folks to hear.
Yeah, absolutely. It's an interesting time of year for me to even to be sharing it and talking about it. It was 5 years ago, right now, 5 years ago this week that I was sitting in treatment, a place that I never thought I would end up, especially, entering, treatment after being, kind of stranded homeless on the streets of Los Angeles looking for help and not being able to find it. My addiction story, I love that you ask about my recovery story. My addiction story, just as a quick qualifier, I had an up and coming career as a youngster in politics. I did well in school, participated in extracurricular activities. I worked on the Clinton Gore 96 reelection campaign as an intern when I was in high school. And then my freshman year in college, I had landed a job working at the White House while I was attending classes at Marymount University. And shortly after President Clinton left office in 2001, I stayed in D.C. And was working for the Democratic National Committee. And in 2003, went on a hiking trip and injured my ankle and my knee really bad. Ended up in the care of an urgent care physician right outside of D.C. and was prescribed a high-grade opioid, hydromorphone. And really the nexus, the perfect storm for me was shortly after that injury and that doctor's visit. I ended up back home for me, and home for me was South Florida, Broward County. And if you know anything about, the opioid crisis, the addiction crisis, that it, a big part of it was this boom of pill mills in the 2000s. And that's where I found myself. I found myself in the epicenter of the pill mill crisis. I lived right outside of Broward and near 95, and which was also known as the Oxycontin Express, and got caught up in that mess and got caught up in it really bad. That started my kind of addiction journey, addiction to Oxycontin and opioids, and later down the road, heroin, and multiple attempts at treatment and rehab and sober living, and family not knowing what they were doing, me not knowing what I was doing, and leading me all the way up to the evening before Thanksgiving 2014, when I found myself on the corner of Hollywood and Highland, without a place to live, without food to eat, no insurance, no money, begging to get help. And I did end up finding help that week. I did end up going into treatment, and that was really the beginning of my recovery story. Now, I mark February 2nd, 2015 as my recovery date, because that's the date that I actually left treatment. That's the date that I was off all medications. That's the date that I entered recovery housing. And it's an important day for me. When I was in treatment, nobody gave me a shot. Everybody was like, you're going to be back out. This is not the end for you. You've got some more learning to do. And I was very resistant to the treatment process. I was very resistant to the structure and the organization, very resistant to meetings, and really had kind of convinced myself throughout treatment that this might just be a short reprieve for me, that I was probably going to go back out. I was probably going to use heroin again. I was probably going to end back up homeless again. I mean, that's just crazy thinking, right? I had never really had a fair shake at like a decent sober living that was kind of safe and stable, and people were sober, and there was a real peer network to plug into. And the day I got discharged from treatment, I had no money again. I had no belongings. Literally everything I owned was in 2 trash bags. And it was my counselor at that treatment center, that treatment facility, who made a phone call to a local sober living, got me a scholarship bed. A guy by the name of Adam picked me up in his Toyota Corolla from the front steps of my treatment center and took me to the house and took me to a meeting and told me to hang out with him and some other guys. And that was really the beginning for me. I thought those first several months that there was no way that I was going to get through this, that I was definitely going to end back out on the street using and back in this rinse and repeat cycle of rehab. But that's not, how the story went. I plugged into a peer community that was really able to lift me up when I wasn't able to lift myself up. I focused on my recovery very, seriously for that first year. Went to meetings every single day. I drove Uber. I worked some odd jobs, but I was still like incredibly ashamed, right? So was my family. Like, I didn't want to talk about, my addiction. I certainly didn't want to talk about my recovery. I didn't want people to know. I was afraid of what people would think of me. That all kind of came to a screeching halt for me about 18 months in. I was still living, about 13 months in, I was still living at a sober living. And by that time I had been kind of graduated to be one of the house managers, and a lot of friends started dying, right? Like roommates of mine started dying. People who I went to treatment with, people who I really cared and, came to love, and members of my community. And they weren't just dying because they were overdosing. They were, they were sober, and then, they had a recurrence of use and they couldn't find help, right? Like they were showing up at hospitals and telling, emergency room staff that they had a problem with heroin or opioids or, drugs and alcohol, and they needed treatment, and they were being denied treatment.
Wow.
They were being denied housing. They were being denied care, and they were dying as a result of it. And it was after my friend Nick died and my friend Greg died, and those first few friends that I started to look outside of just my local recovery community to see what is it that we're doing. Like, why are my friends disappearing? Why are they dying and nobody's talking about this? Why are they being denied care and nobody seems to really, care? Nobody seems to really, other than the family that's left behind, nobody seems to be really making an uproar about this. Like, this is wrong. Something is wrong here. And I was always told, early on in recovery that some may, some die so others can live. And I just don't subscribe to that. I can tell you that my friends didn't have to die for me to sit here today and be alive and well and in recovery. I mean, that's just total hogwash. That cliche is completely hogwash. And that's when I started getting more involved. That's when I started, connecting with others in the recovery community from around the country. That's when I started realizing that there was an actual recovery movement, right? That's when I started seeing that people were actually using their recovery stories for impact and changing legislation and, really getting involved in the process. And as someone who was, once had a career in politics and as a community organizer, I started employing some of those same tactics around community mobilization, organization, political activism, using addiction recovery as the cause, as the issue, to register people to vote, to show up at legislators' offices, to demand more changes, to organize communities. Because what I could see and the numbers I was hearing was, there's 23 million people in long-term recovery, and about another 22 million people who are currently struggling and need help. If you put those numbers together, that's about 45 million Americans. If you do the math, that's about 1 in 3 American households, yet we're very slow to get solutions. And I was like, that doesn't make sense because the math is in our favor. Like, 45 million Americans, 1 in 3 households, like that's a larger constituency than the gun lobby. That's a larger constituency than, the pro-life or pro-choice movements. That's a larger constituency, possibly than LGBT. And I know there's an LGBT man. Like, why is it we're so slow to get solutions? Well, that's because those 45 million people, a lot of them aren't talking about it, and a lot of them aren't being heard, and they're definitely not organized. So I was like, what if we could we don't need every single person to go out there and bang on the door of their legislator, but if we had a couple thousand,
right,
we would make massive change. There's a guidebook, there's a historical precedent for what we're doing in our advocacy. When the AIDS epidemic was at its height, there was roughly 43,000 deaths. There were not every gay person in America got up in arms to demand change in funding, but a few thousand people did. And what we saw were billions of dollars in investment and in science and in research that have gotten us to a place in 2019, 2020, where now AIDS is a manageable chronic disease. That's the same type of activism and advocacy that we need to see if we're going to really curb overdose deaths. Because the opioid crisis, the addiction crisis, I can tell you, is a very, it's a popular keyword. It's a popular stump speech for politicians. Yet we don't see the same level of funding and solutions following the political rhetoric. And that's really, where my frustration comes from. And really my advocacy is driven from a level of grief still, over friends who are dying still today. I mean, we look, my friend Garrett and I, my best friend Garrett and I, we got this list, and it's close to 30 people in the last 3 years. That is insane. Median age 26 years old. People who are dying of preventable deaths because they're not being offered the care that they need. That's wrong, and it needs to change.
How can you go to the ER and not get help? What does that look like? Like, I think a lot of people don't understand that over half of the ERs in the United States literally do not have a plan for someone who comes in the midst of addiction, who's coming in overdosing. They literally do not have a place to send you. They don't have a way to treat you. They don't have anything they can do for you. Why?
Well, I mean, it's the number's actually worse than half. I mean, I would say it's probably closer to 95% in terms of hospitals that actually can treat substance use disorder in terms of their emergency rooms, right? So right now, there's a huge stigma and bias against drug users when they walk into an ER room, right? Like that we know, like staff at and I've talked to emergency room doctors, like they just want to get quote unquote those people in and out of their ER rooms as quickly as possible. They do not, at its core, they don't see them as worthy patients, right? They see them as drug addicts and dirty junkies and all the, the stereotypes that come with drug use, and people die as a result of it. A lot of hospitals now will be able to offer naloxone, EMTs, they'll be able to revive people, but it's basically catch and release. They'll revive somebody and they'll send them right back out on the street from where they came from.
Why do these hospitals not have relationships with like a sober house or something where you can maybe even just send somebody overnight to have a place to go, or for 2 or 3 nights or whatever?
Right. And in a perfect world, an ER, if somebody's walking into an emergency room and they're using or they've overdosed, it's the equivalent in my mind to like somebody walking in with a heart attack. Like that,
I agree
hospital should be able to, revive, treat, keep, triage, offer medication, a continuum of care, all of that. That doesn't happen. In a perfect world scenario, somebody would come in, they would be, if it's opioids, they could be dosed immediately with a buprenorphine, right in the hospital setting. There is medication, that is available, that is FDA approved, that would be able to be administered in an ER setting. There would be a warm hand if the hospital can't actually admit the patient for treatment that they may have on site in that hospital, there'd be a warm handoff to a peer recovery coach, to a recovery community organization, to a sober living. There would be some sort of continuity of care as opposed to just throwing somebody out on the street corner. I'll tell you a quick story. My friend Nick, who I mentioned early on, who died of an overdose, was really the catalyst for me getting involved. Getting involved at a very high level. I was the sober living manager at this sober living in Pasadena, like I said, and Nick was, about 23 years old. He was one of our residents. He happened to be my roommate, and he had been living there for a couple of months. Really good kid. Came home one night and said, I can't stop using. I'm using again. I don't know what to do. I know I can't stay here tonight because of the rules, and the owners won't let me stay, but I'm afraid to call my mom because they're going to never talk to me again. My parents will never talk to me again. I have no insurance. I'm afraid to talk to my job because they'll fire me. I don't have any money. I don't know what to do. What do I do? Help me. And, that's a tall task for somebody who's, barely a year sober themselves. And,
right.
But we did what we knew what to do, which was we sat Nick down in kind of the common area at the sober living, a bunch of us guys, and we talked to him and came to a conclusion and a plan that, okay, Nick, you need some detox, you need some help. We're not doctors, but if you go to the hospital, they have to treat you. They have to see you. Go to the ER room, tell them what's going on, tell them you can't stop using heroin, tell them you can't stop using opioids, tell them you need help, get some help there, let them check you in, get detoxed, come back, in a day or two, and we'll hit the reset button and start over, and you can have a place to stay here. But you've got to go to the hospital and get medically cleared first. Now, there was no doubt in our mind that he would get these services at the hospital. This was one of the best hospitals in Southern California. One of the best hospital systems in the United States is this hospital that was just happened to be a mile away from our sober living. This was about 9:00 at night when recovery meetings had kind of wrapped up for the day. So going to a recovery meeting really wasn't an option. So Nick went to that ER room. From what we know, he spent about 3 hours there. He was triaged in and out, given no medication, not even given naloxone to take home. He was given a piece of paper, a white piece of paper with a bunch of crisis 800 numbers on it.
Oh my gosh.
And possible public centers that he called the next day. I don't know about you, but for someone who's in the midst of a crisis, those things are very hard to navigate. And he was kicked to the corner with receiving zero services. Walking home that night, Nick used one more time, and his body was found the next morning about 3 blocks away from our sober living, slumped over on the sidewalk.
Wow.
And he died that night, and he died in the process of asking for help. That's the state of emergency room healthcare when it comes to substance use disorder today. Still today, very few hospitals are able to offer the qualified care needed to save lives. There are a few that are taking a disruptive, very recovery-informed approach. You look at Mass General. They've got a great pilot program going on with recovery coaches. Recovery coaches and warm handoffs is kind of the new trend in terms of emergency room care. They're doing it in Alaska. They're doing it in Las Vegas, Nevada. That is a solution that will help close that gap. And keep people like my friend Nick from dying while in the process of seeking care. But the healthcare system is incredibly, behind the times in terms of being able to treat SUD. We have a lot of work to do, but I am confident that we'll get there. I think the country is woke enough. Hospital administrators are woke. I met with the Colorado Hospital Association several weeks ago, and a doctor who now has made it his cause to get programs like warm handoffs and naloxone and buprenorphine in ER rooms, that he has made it his main cause. And he, a young guy, probably younger than me, who said, he was sorry for stories like Nick because he knows of countless stories just like that emergency room physicians and emergency room staff have just been unwilling to change, unwilling to look at something new, unwilling to really look beyond, substance use disorder and addiction to into the eyes of these patients as human beings, as people who are deserving of care, deserving, of wellness, deserving to live just as much as the next patient. So, it's a long time coming, but I'm confident we will get there.
What do we have to do? I mean, I guess my two questions that come to mind from what you've said so far, and I think these probably dovetail together, is yes, politicians are talking about it, but you said that the funding is not following the rhetoric. And then, the hospitals are just not prepared to handle these situations. How do we get the funding to follow the rhetoric, and how do we fix the hospitals? I mean, it sounds like a pretty tall mountain to climb.
It is, and it's on a state by state basis. Specific to the hospitals, it's really state by state because it's mandating care on a federal level is difficult, especially when it comes to hospital systems. But on a state level, it's a little bit easier. So we are seeing state coalitions kind of pop up that are addressing this in different states. I mentioned a few just a few moments ago. On the federal level, in terms of funding, that's something that is important to attack from the top down, meaning kind of Congress and the Senate, and then making sure the money gets to the states, and then the states get the money to the communities. There's again, I'll cite the AIDS crisis. There was the Ryan White Act at the height of the AIDS crisis, which really changed the trajectory of how we care for and treat AIDS, and has gotten us into the position we are today with curbing AIDS deaths and providing HIV treatment and community health clinics and et cetera, et cetera. The money has to be able to have local control, but we need massive amounts of money. So for comparison, AIDS research, AIDS care gets on average between $20 to $25 billion a year. Addiction recovery, more specifically recovery, gets, we would be lucky to find, $2 to $5 billion a year. We need on par, what AIDS HIV gets, right? We need at least $20 billion a year if we're going to make a major dent in combating the crisis. There is a piece of legislation that is, right now on the Senate floor called the CARE Act. It would provide $10 billion a year for 10 years in grants to local governments and states to combat the crisis. We've seen presidential candidates really, several of them that have laid out robust proposals that are on par with that $10 billion per year commitment. So I think we are getting there. But the sad thing right now is like the CARE Act, it's having a hard time getting a committee hearing in the House, right?
Why? Like who's against? I mean, I'm sorry, but who is against? Like, this can't be a partisan issue.
It's not a partisan issue, but it is a touchy issue because of the price tag. Right now, you go, Congressman Frank Pallone, who's the chairman of the House Energy and Commerce Committee. He's from New Jersey, Democrat. He's supportive of the CARE Act, but he won't give it a hearing in the Energy and Commerce Committee. I mean, Pelosi's a co-sponsor of it. Senator Warren's the co-sponsor in the Senate. It's having a hard time getting a hearing. A Democratic bill is getting a hard time getting a hearing in a Democratic legislature, Congress, which makes you think that some of it is lip service. I think they're waiting, for the election. There's the word on the Hill is that there's no way this bill is going to get through in an election year, which I think is total hogwash and BS. But it's the reality of the political climate that we live in today. But the flip side of that coin is there's no really outraged advocates other than a few that are banging down the doors of Pallone's office, demanding a hearing, which is why we need to build civic advocacy and civic capacity around, direct political engagement, so that we can put pressure on politicians to not stonewall us and offer us just a bunch of platitudes as opposed to real action. But the CARE Act is a good bill if it could get a hearing. Some of these presidential campaign proposals are very good. But let's say in a perfect scenario that we do get that $10 billion or we do get that $20 billion a year. The next fight is to make sure the money actually finds its way to the front lines, right? So there have to be internal controls to make sure that money actually gets to where it needs to go. That money actually makes it to frontline services, that all of it's not just spent on treatment. Part of my fight is it's like, look, you hear about addiction recovery and how to combat the opioid crisis, and usually you'll hear treatment, law enforcement and interdiction and prevention. And if we're lucky, they'll lump recovery in with treatment. You don't hear about long-term recovery supports. You don't necessarily hear much about peer recovery support services, which are things like sober coaches and recovery community organizations. You don't hear much about harm reduction, which is something that leads, is a pathway towards recovery, right? I know I could have benefited from harm reduction services. I know many of my friends would be alive today had they have had access to harm reduction services, because it creates trust with the user. It provides them with resources. It helps keep them alive, until they could find a sustained pathway to recovery. I mean, there's all sorts of benefits in harm reduction. So we need people in recovery and in the harm reduction world to be making their voices more heard, louder. We need them to be educating their local politicians.
How do we do that? I mean, let's say I want to help and I want to get involved and be part of this advocacy. And maybe I even view it as part of my 12th step. Maybe I'm considering getting involved politically. Got a little bit of time, a clean time, and I want to help. Where do I go? Where can I point my energy if I wanted to help?
Look, I tell people, you don't have to be a policy expert. You don't have to be a doctor. You don't have to be a politician. You don't have to be a professor or a scientist or a data expert. Like, we as people with lived experience really have a much, I think, more unique and valuable perspective on what needs to happen, what's happening in our own communities, than some of these experts who really just see us through the lens of data and science, right? We actually can put names and lived experience to what's happening. Making an appointment with your state senator, your state assembly person, your member of Congress, telling them your own story, telling them the barriers that you've experienced in seeking help, some of the barriers that your family members, loved ones, friends have experienced, telling them the stories of your friends who have passed. Like, these are super impactful ways that can reach a legislator that data experts and scientists and people who author reports never will be able to. On the other end, there's organizations that you can get involved with. I mean, we have the Recovery Advocacy Project, recoveryvoices.com, which is a direct political advocacy organization that's organizing state by state, providing the tools, the resources, the training to advocates and people with lived experience on exactly how to do that. How to talk to your legislator, how to have a town hall meeting, how to do a community assessment to figure out what gaps in services exist in your area, how to find out if a legislator or a politician is just giving you lip service or whether or not they have action to really back it up. That traditional community organizing approach that industry meaning, big pharma and corporations has long taken to get their agenda through, people with lived experience and people in recovery are now carrying the banner on. And I'm really excited about it. So people can get involved. The Recovery Advocacy Project is one way to get involved with more direct political advocacy, because while we're a nonprofit, we're a 501c4, which allows us to have a little bit more leeway in terms of lobbying and direct political advocacy. There's other established organizations such as Faces and Voices of Recovery, which is a 501c3, and Shatterproof, which is a 501c3 for young people. There's Young People in Recovery, which has chapters all around the country. I mean, there are various ways to get involved. But there's also people out there who just aren't ready to join a national brand or national organization or really organize at that level. And it's one person wanting to make a difference. Well, one person can make a huge difference. I'll give you a kind of a case example. About 2.5 years ago, my sponsee Tyler died in a sober living here in Pasadena. I was crushed. I mean, it was my first sponsee. It was
Wow.
a crushing time for me. The circumstances of his death made me even more angry, though. Tyler was living in a sober living home, paying his family is paying $2,000 a month for him to live there. It had been a long established place that most of the people, young people who lived there were in recovery from some sort of opioid. Tyler came home one evening and was using again. And he called me and he said, I'm using again, but they're going to let me stay here at the house tonight. And I was like, okay, good. At least you have a safe place to stay tonight. I'll pick you up in the morning. We'll go to a meeting. We'll figure out what we need to do. Made an appointment with him, and he died. He died the next morning before I was able to talk to him or,
Wow.
get there to pick him up. and it was crushing. But as I learned more about the circumstance and how he died, really made me angry. The house manager had come down at about 6 a.m. to check on him. They had him sleep in the living room, and Tyler was clearly overdosing. He could hardly catch his breath. He was blue. He was still alive, but he had like that death gargle going on. He was clearly in the midst of an overdose. The house manager called the owner. The owner came over with the house manager. There was, no naloxone. Nobody knew how to respond to an overdose. Nobody knew what to do. Pure mayhem in the house. They called 911 in the 4 minutes that it took, the EMTs to get to the house. Tyler died.
Wow.
And that made me angry, because it made me angry that these folks were taking this money from him, claiming he had a safe, stable place to live, and didn't even bother to have Narcan, naloxone on hand, or even how to trained on rescue breathing, how to respond to an overdose, nothing. And I went to the house owner and I asked them, why was this? How was this that my friend could die? This was a preventable drug death. Yes, Tyler used. Yes, there was some accountability there, but he was also paying to live in this home to provide a safe environment. The least they could be doing with the exorbitant amount of money that they were taking from his family was having naloxone on hand, and know how to respond to an overdose. And the response that I got was a hand on my shoulder and, kind of a dead stare from the owner. And the owner said, don't be upset at us, Ryan. The real sad story here is that Tyler just didn't want to get sober enough. Like, he wasn't willing to go to all lengths. And that just really set me into orbit. And instead of, going back home and grabbing a baseball bat and, taking out the windows of this sober living, which is what I would have used to have done, I said, this is wrong. If this is happening here, in this white affluent neighborhood that is, this upscale sober living, how many sober livings across the country? How many Tylers are there out there? How many people have died because homes are not willing to carry naloxone? Sober homes are taking all this money, but not willing to have any accountability or any type of consumer protections. And a couple of Tyler's friends and I said, well, let's go tell Tyler's story. Let's go to our state senator. And this was without any organizations attached. This was without any national, 501c3 or 501c4 or big lobbying effort or anything. This was just 3 or 4 young people in recovery who, many of them, majority of them, never even cast a ballot themselves or participated in the political process, went to our state senator, went to our state representative, and went to our member of Congress. And we told them what happened to Tyler. We told them Tyler's story. We told them what was happening in their backyard, in their district, how our friends were dying, how these houses operated, how there were no protections for people in recovery or protections for people, when there was an overdose, how there was little to zero regulation around sober homes in the U.S. And out of those meetings where we just simply had some storytelling, we shared Tyler's story. We shared our community story. A piece of legislation was written, H.R. 4684 in the U.S. Congress, which was also known as Tyler's Law, also known as the Ensuring Access to Quality Sober Living Act of 2018. There was a similar version of that bill introduced in the California legislature. The bill provided, for the first time ever, it published standards on what a quality, safe, sober living would look like, which included naloxone and overdose response. It provided up to $2 million in technical assistance and infrastructure building for states that wish to apply those standards to regulations in their states. It was passed in the U.S. Congress unanimously. It was passed in the U.S. Senate with 1 vote against it, and it was signed into law by President Trump last October. That's real advocacy, and there will be thousands of lives that will be saved because of it. And it was only a few people who got together and just decided, who aren't politicians, who aren't experts, who aren't, gurus in the space. They're just people who have a story to tell. That's the power of lived experience when you marry it with advocacy. That's how people can get involved. Getting involved in a national organization, starting an emerging nonprofit, running for office, it might be for some. We need more recovery people serving in elected office because there's all of these decisions being made about us, without us. And at some point, recovery people need to be not just, on the outside, banging, trying to get involved in the process. They need to be in the process, making the laws themselves. But there's countless ways to get involved. The first question I ask people is what are you passionate about? What do you have to offer? What's your skill set? There's a way for everybody to be involved. For some people, it's on a smaller scale. For some people, it's a much grander scale. But there's certainly no shortage of voices in the process.
Is there a resource or a list out there where someone could go and just peruse a bunch of the ways they could get involved? And maybe somebody's listening that wants to donate to one of these groups, or maybe somebody's listening that wants to volunteer their time. Is there a list somewhere of where you can get involved?
Yeah, I would direct people immediately to, the first place it would be recoveryvoices.com, which is the Recovery Advocacy Project. If they want to get more involved in kind of direct political action around addiction recovery as an issue. There's also, check out Google started the Google Recover Together initiative for the recovery advocacy movement. It's g.co/recover together. On that page, there's a listing of all different types of national advocacy organizations in addiction recovery, whether it's treatment, young people, recovery support services, housing, all the kind of qualified organizations are listed out there. And then if you want to get more kind of involved disruptively and politically, I again would direct folks to recoveryvoices.com to check out. And that's the organization that I'm most affiliated with.
Got it. As far as politics goes, we're in a election cycle, and if you care to, and you don't have to, but which of the current candidates that are running for president are sort of at the top of the list as far as recovery friendly or mental health friendly? Who's saying a lot about it versus the others?
So I will say they're all saying a lot about it. What they're saying about it, though, and how they plan to pay for it are kind of what's equally as important. They're all talking about it, and I'll so I don't get myself in trouble here. I'll give you kind of an asterisk. The Trump administration has done some great work. Have they done enough? Absolutely not. Has some of it been lip service? Sure. Have they, gotten us some funding? Yes. I would say that I think any person who would be president of the United States, though, right now would be providing funding to end the opioid crisis.
Right,
they have to. It's definitely not by choice,
Well, when you get a bill that's unanimous or 99-1 and it's for public good on your desk, I mean, I don't know anybody who doesn't sign that bill.
Right. I mean, but they have done some good work on this. Elizabeth Warren is running for president and has the CARE, she's a sponsor of the CARE Act, right? So, I mean, she, cares about this issue. Senator Sanders and Medicare for all. I mean, you can't really, not end the opioid crisis and the addiction crisis without at least a massive expansion of Medicare and Medicaid services. So, I mean, a total revamp of the healthcare system is needed. All that being said, I have endorsed, publicly Pete Buttigieg and his plan to combat the addiction crisis, because not only does it call for $10 billion a year in healing and belonging grants, but it also has a very specific focus on expanding the peer workforce, peer recovery support services, long-term recovery support services. It has a very interesting focus on harm reduction. It really is very all-inclusive of a very long-term continuum of care, which begins during drug use. So his plan has been very well informed, and I see it as the most viable plan. I also see it as the most disruptive plan. And quite frankly, a lot of the things in the plan are things that, our community has been screaming from the rooftops for years to try and get. So I'm very optimistic that his plan is the one. That being said, I don't, I know that the country's quite politically polarized right now.
Right.
And I think it's important that people with lived experience, recovery advocates, are involved in all the presidential campaigns. So I don't care if you're a Trump supporter or a Bernie supporter or a Buttigieg supporter or a Yang supporter or whatever it may be, or Sanders, it doesn't matter. I would ask you to get highly involved in the process with that, whatever political campaign you're leaning towards or support, and help inform their policy on this, because at the end of the day, one of them will be president. And it's important that we spread our resources out there to make sure that we are informing all of the campaigns, because every single one of them should have a robust proposal on how to end the addiction crisis.
One thing you mentioned peer-to-peer, and I've got a venture fund that I'm trying to raise money to invest in startups in this space. And I think that peer-to-peer solutions, when you look at the sheer volume of people who need help, there will never be enough doctors, there'll never be enough psychologists, therapists, psychiatrists to treat the mental health and the addiction issues that exist globally. And so I think peer-to-peer solutions are a must-have. And I'm curious, do you think those solutions, and we've talked a little bit about what the government can do from a private investor point of view, what are the things that could be built privately that could be for-profit solutions in this space that could be helpful?
Well, let me just first say the peer-to-peer, peer recovery supports is the way to close the treatment gap. So, I mean, we could have treatment centers on every corner in this country. We will still maintain a, 80 to 90% treatment gap, meaning 8 to 9. I don't think we would reduce the treatment gap by that much. I mean, even when you have treatment centers, there's financial barriers and insurance barriers, cultural barriers.
Right.
All sorts of things that prevent people from getting into treatment. Peer recovery supports, though, will close that treatment gap, meeting people where they're at. Warm handoffs, like I said, recovery community organizations. Expanding the peer workforce in this country is incredibly important. And I think politicians and policymakers are starting to wake up to that reality. Look, not every single, and I know that I'll catch a little slack for this, but not every single person needs treatment.
I agree with that.
I mean, I could tell you this last go round for me, I probably didn't need treatment, but treatment's all I knew. I had no idea what a peer was. I would have benefited from a peer way more than I would have benefited from sitting in a treatment center for, 9 weeks and watching reruns of Cops. I mean, I mean, that's just the reality. And I think that's reality for a lot of people. So government solutions are never going to be enough either. Corporate America has got to step up their game in terms of their investments into this space, into this cause, both on the for-profit side and also on the philanthropic side and on the CSR, corporate social responsibility. Innovations, from peers, from people with lived experience, are super important. We need more innovation in the space, but getting corporations, getting VCs to invest in more peer-led ventures, that provide on-demand services, whether that be through technology or whether that be through on the ground or whether that be a marrying of both, which is kind of the dream, is how do you marry, tech and kind of traditional on the ground services. Those are things that we have to look at, because you go to rural Nevada or rural Alaska or rural Arkansas, sometimes it's 50 miles between a meeting space or a treatment facility or a medical provider and where somebody is that needs help. So there's got to be a way to marry tech with peer services.
One of the things you mentioned, that's really helpful. Thank you. And one of the things you mentioned earlier on, we talked about how doctors even will stigmatize people who come in needing help. What's up with stigma? Where are we as a society, as a country, with how we view people who are living with addiction, and where do we need to get to, and how do we get there?
Well, I think that we're getting there. The more people that identify as someone in recovery, someone who loves someone in recovery, someone who's struggling, someone who, family member, the more people identify and normalize it, the more we're combating that stigma. And I go further than calling it stigma. It's systemic discrimination and bias against people with a medical condition. I mean, That's just what it is, right? I mean, and stigma is kind of just a nice way of saying it. But I think that we are on the way to combating that, which has been a historical problem. I mean, this is, the drug crisis in this country isn't 5 years old. I mean, we're talking of decades long war on drugs and war on people who use drugs. So I believe we are getting there. The more and more people get involved, the more and more people that identify. Specific to the medical field, there's still a lot of education to be done. Medical schools are still not providing the training, necessary not just specific to the opioid crisis, but how to treat addiction. I think that, doctors who have been around for a long time, who have been in this practice for a long time, are adverse to learning anything new. So it's going to take a new generation of doctors and MDs that are willing, to spend the time to learn and to educate themselves and to really learn how to provide compassionate care to people suffering with SUD. But we are getting there. It's not going to happen overnight. It's probably not going to happen in the next 5 years. But I think that, there at the end of the day, there is a lot of hope for me. I see small changes happening in communities that I think, just like a butterfly effect, are going to have seismic impacts all across the country.
That's awesome. One thing you said there was the war on drugs, and you mentioned the war on people who use drugs. How does that manifest itself? What does that look like? Is that, for me, what comes up there is, I read a book, which probably makes me dangerous, called American Psychosis, where they map out kind of mental health legislation from 1960s all the way through today. And I read a lot of really scary things about how the government's done its best to try to legislate, but there's always these unintended consequences. And I've read a little bit about how there's been concerted effort at times to put people in jail because of their drug use, but the driving motive behind that was really their race or something else about them. What can you say about that?
Sure. I mean, the war on drugs has been at its heart is a racist war. I mean, it's a war on race, it's a war on class, it's a war on poverty. It's disgusting. The war on people who use drugs. I mean, it's there's no help in criminalizing a health condition, which is basically what it is. We're locking people up for simple possession. There's states and counties in this country who are putting people in prison for life. These drug-induced homicide laws, which is just ridiculous. I mean, it's two friends are using together. One friend ends up dying. The friend who ends up surviving, if they use the same bag, ends up getting a murder charge.
Wow.
I mean, you can't, it's like we're talking about that we can't wrest our way out of the crisis, but hey, let's just keep criminalizing drug use. I think decriminalization of drug use, decriminalization of possession, decriminalization is really a massive step forward, but we're a long way from decriminalization nationwide. I think again, this is an issue that needs to be taken on state by state. I'm not, people ask me oftentimes, are you for the legalization of drugs? Well, I don't know yet. I mean, I know that in certain countries that have studied this, legalization has actually been a very good thing. How will that play out in the United States? I don't know. I'm still kind of, weighing the pros and cons of that. But I can say unequivocally that decriminalization, we have to get there sooner rather than later. Locking people up is not the answer. And sadly, it ends up being people of color who end up getting locked up, right? Not people like me and not people like you.
That's exactly right. And, it's interesting because I just think that there's a lot of people out there that are going to resist change here for a couple of different reasons. I think there are people who are financially motivated to not see change. I think that has to do with a lot of medical industrial complex stuff going on there. I think there are people that are hate-filled that want to see the system stay as it is because they like the fact that it's really a race war. I think there's a lot of resistance in the system. And while we talk about stigma, and I think stigma is important, I think there are people out there that are working against us, like just straight up intentionally working to keep it status quo.
Absolutely. I mean, the status quo is public enemy number one. There's a lot of people making a lot of money off of us right now. There's a lot of people making, I call them kind of, they're moral entrepreneurs in this space who have have really planted a flag and don't want to see much changed and really want to see the focus remain on just prevention and treatment and not necessarily look at all the other options, all the other toolbox items that are out there. Sometimes, the fight for change, the fight to save lives is even more disruptive within the community than it is without the community. And we have policymakers looking from the outside saying, you guys are all fighting yourselves, because they kind of lump us all in together. So you're absolutely right. I mean, people are resistant to change.
Yeah.
But, look at where we're at today. we have to try something different. We have to be looking at new innovations. We have to be looking at evidence-based ways that save people's lives. We have to be looking at new things that communities are doing that may not, traditionally, be as widely as accepted, but at the end of the day, are working. We have to be open to innovation. That is paramount.
Yeah, I agree with you, and that's where I'm focusing my sort of professional efforts right now. And look, a lot of the stuff we've talked about here has been pretty heavy, and I know I've taken a lot of your time, but I wanted to sort of wrap it up here with a little bit lighter question around one of the things I like about your social media feed is usually I see it on Saturday morning when I wake up, but it seems like you're always asking people to just remember to be grateful and to share what they have gratitude for. And, that's a concept that comes up a lot in the recovery community. And I think practicing gratitude is a really, really healthy thing for humans to do. I think it's something that came up in a Bible study that I was at today at lunchtime. This idea of practicing gratitude, can you tell me a little bit about why that's important to you and why you're constantly reminding people to do so?
Yeah. I have found that remaining in gratitude for me makes it not just easier to get through the rough times, but also broadens my perspective of just, how small the bad things really are, because I have so much to be grateful for. And at the end of the day, everything could go wrong in my life today. And if I could stay, or this week or this month, and a place of gratitude will keep me humble and will remind me how lucky I am to have something like a roof over my head or food, or to be sober, or to be able to have my mom answer the phone, or to be able to be engaged. I mean, simple things. It really allows me to reflect on the simple things and how incredibly blessed I am for just those few things. And if I can remain grateful, I know I can get through another day. And gratitude sometimes is the one thing that makes everything okay. Like literally my entire life could be a storm. It could be a total storm of just craziness. Everything could go south for me. And with a little bit of practice of gratitude, some humility comes. With humility, calmness comes. With calmness, I'm allowed to, go to sleep, wake up the next day and do better.
Yeah, that's really helpful, and I appreciate you sharing that. And look, this conversation's been great. I think I've learned a lot, and I think that people listening, especially my audience, will learn a lot about what's going on at the policy level, what's going on with the healthcare system, what needs to happen, what is happening to help solve this problem. And I'm really grateful that you took the time to come on here. I know you're busy. I'm really, really grateful that you took the time to come here and share with us. And I just wanted to say thank you for doing it, because it's making people, it's educating people, and I think it'll activate people to do more. So that's amazing.
I appreciate it, Stephen, and looking forward to continuing to work together. Thanks so much for having me on.
Yeah, thanks again, man, for coming on. I really appreciate it. I think this will educate a lot of our audience. I think it will help some people. I think it will encourage some people to help others and get involved and do something in their communities and with their politicians to further, to improve, whether it's politically or whether it's with the healthcare system or whether it's with local resources or peer-to-peer resources. Maybe this conversation will fire some people up to get involved and help out with this cause. So thank you again for coming on. Thank you to our listeners for being here today. Thank you for your support. We would love it if you would support us by giving us a review, subscribing on iTunes or whatever podcast platform you listen on. And we'd love to hear from you. Any feedback you have, we'd love to hear from you on Twitter at StigmaCast. We'd love to hear from you via our website, stigmapodcast.com. And until next time, thank you for being here, and we'll chat with you soon.